Hello, and welcome to the third part of this mini lecture series on sexual health. I had mapped out a plan in the previous two lectures that we're going to veer from. No surprise to anyone who's ever been in one of my courses. But I'm going to veer off very briefly, and I want to talk a little bit about sex education because it's an important part of understanding modern sexual health, particularly in the United States. So, I want to talk basically about the various approaches to sex education, and then I want to just dive in very lightly into some of the data about those different kinds of approaches. So the first thing we have to understand about the United States in particular is that adolescents in the United States have higher rates of sexually transmitted infections and unintended pregnancies compared to other industrialized nations. Now, of course, part of that has to do with healthcare. Because we do not have comprehensive health care in the United States. And so, unsurprisingly, that translates into lower rates of health overall and increases in pregnancy because we have less availability for contraceptives. And in the next lecture, I'm actually going to talk about universal contraception and a program pilot here in Colorado. But we have to think about why adolescents might have those higher STIs, and certainly part of that healthcare, though, but another big part of that is inadequate sex education. And over my lifespan, this has gotten worse in some places and better in some others. It's astounding to me the lack of sexual knowledge that adults display in the United States. I've taught human sexuality at a few universities, and the fact that adult women in their 20s are unaware of the fact that their fertility is not differential across the menstrual cycle is astounding to me. That's simple basic biology that we should be teaching every student everywhere. And so this is an issue that we're going to have to think about. So one of the things that we have to think about is based on reasons given for not using contraception. One of the reasons is because there's a fundamental lack of knowledge about sexuality and sexual health. And this is particularly important. Pregnancy is not just part of our sort of natural life cycle. It's also a significant health risk and is associated with a number of factors, but also in particular is a barrier to education oftentimes, certainly a barrier to higher earnings. And so we have to think about those issues in that context. So there are a number of things we have to think about in terms of health overall that have to deal with contraception. So here's some reasons why women who had an unintended pregnancy said they did not use contraception. The number one reason is they did not think they could get pregnant. Once a girl has started menstruating, she can get pregnant. And so that is the point at which we need to be explaining to young women how pregnancy occurs, how to prevent that, and being very clear on the natural processes involved. Some people didn't mind getting pregnant. Some people are concerned about the side effects of birth control. And certainly, when some women report higher levels of side effects than others, but there are other options, barrier methods, that sort of thing. Not expecting to have sex, well, that's an issue, and certainly one of the things we talked about when we talked about pre-exposure prophylaxis with HIV prevention. There are a couple of ways to go about preventing HIV infection, and one of them is a daily pill. Just like with a birth control pill. Fortunately, it's less subject to the vagaries of the schedule of birth control. Birth control is pretty unforgiving. A few people, their male partner did not want to use contraception, and in a few cases, the male partner did not want them to use contraception. And let me say, the first of all, for every woman who might be listening to this, your body's your body. If you don't want to use contraception, you don't use contraception. If you want to use contraception, you want him to use contraception, they need to be using contraception. Those decisions are yours to make. And so keep that in mind. Now, of course, they aren't always yours to make in some instances. But if they refuse to use contraception, No means no. And so think about that. So there are some different approaches to sex education. Abstinence only. Abstinence only education is where kids are taught to abstain from sex. Basically all they're taught. There's no information about contraception or condoms. Basically, oftentimes a fear-based campaign. Abstinence Plus is where abstinence is advocated, but contraception and condoms are discussed. And finally, comprehensive sex education, where students are provided with a range of information and taught how to make responsible decisions about sex. We're going to talk a little bit on the next slide about some of the data involved here, but the correlate to these approaches are similar to approaches to teaching kids about drugs. And so for a long time in this country, we spent a lot of money on what was called drug abuse resistance education. And it's basically just say no approach. Abstinence only is a just say no approach to drugs. Horribly and completely ineffective. In fact, the data on drug abuse resistance education is not only did it not work, it almost in some instances was worse. So what we have to do is actually teach people the risks involved, talk about the potential problems involved, and allow people to make informed decisions. So with comprehensive sex education, students are provided with a range of information. They're taught all about contraception, all about their bodies, how to make responsible decisions about sex. We're now including information about consent in that sex education, which is incredibly important. And so this is actually, with some pretty good data, the best way to teach students. So here's some data. First off, comprehensive sex education is linked to lower teen pregnancy risk. So we are getting at one of those goals. States with more abstinence programs have higher rates of teen pregnancy. So what that tells us pretty clearly is that those abstinence programs don't work. In fact, evangelical teenagers are likely to have sex at a younger age than non-evangelical teenagers. And so this religious-based, abstinence-based education is oftentimes doing more harm than good. Abstinence programs also directly ignore the needs of gay and lesbian, bisexual, transgender youth, and those who might be sexually active. People have been having sex for a long time. It's how this species is propagated. It's part of our biological drives, and teaching people about it in a safe and effective way is far more effective than just trying to get them to ignore it, because that's not going to work. So reducing teen pregnancies and sexually transmitted infections requires much more comprehensive education, as well as more parental involvement. And that's one of the issues that we've seen as well, is the parents don't want to talk about it. Oftentimes teens don't want to talk about it with their friends either, but they're stuck learning from the internet. And so people are learning lots of myths. They're thinking pornography is how sex really occurs, and these are very harmful ways to learn about sex. So we need fact-based, evidence-based approaches to teaching sex. All right, well, that's a quick introduction to sex education. Next off, we'll talk about contraception.